Welcome to the Truth Chronicles. Have you ever wondered about the numerous conspiracy theories that surround COVID-19? Join us in our exploration into the labyrinth of these theories, a web of misinformation and intrigue that's as contagious as the virus itself. We'll start by delving into four main categories of COVID-19 conspiracy theories. First, there are theories about the origins of the virus. Some claim that this pandemic was born in a laboratory, deliberately engineered as a bioweapon, yet the scientific consensus strongly supports the zoonotic origin of the virus, likely transmitted from animals to humans, such as bats or pangolins. Then we have the conspiracy theories connecting the rollout of 5G technology to the spread of the virus. This theory, despite being widely debunked by experts, continues to persist. It completely overlooks the fact that the virus has spread to regions without 5G infrastructure, proving that the virus doesn't need a high-speed data connection to infect. Next, we have misinformation surrounding COVID-19 vaccines. The rumors range from claims that vaccines contain microchips for tracking individuals to allegations about vaccines altering human DNA. These baseless claims pose a significant challenge to global vaccination efforts, as they undermine trust in scientifically proven treatments. Lastly, we have conspiracy theories promoting alternative treatments for COVID-19. From ingesting disinfectants to using unapproved medications, these theories can have serious health consequences. They contribute to the spread of misinformation, leading people away from effective, scientifically approved treatments. And there you have it, a quick overview of the main COVID-19 conspiracy theories. Each one, in its own way, distorts the reality of the pandemic, replacing hard scientific facts with misinformation and unfounded claims. These theories, while fascinating to dissect, can have serious real-world consequences, often leading to distrust and non-compliance with essential public health measures. Now that we've identified these theories, let's examine their origins. As we move forward, we'll delve deeper into COVID-19 conspiracy theories, exploring how they came to be and the impact they have on public health. So, stick around as we continue to unravel the mysteries of these theories. Where do these theories come from? A question as intriguing as the theories themselves. Let's delve into the two primary sources: disinformation campaigns and the human response to fear and uncertainty. First up, disinformation campaigns. This is a deliberate action by individuals or groups with an agenda mainly to cause confusion, sow discord, or erode trust. You might be wondering, who would do such a thing? Well, it's not always clear, but there are instances where fingers have been pointed at state-sponsored entities. An example? During the COVID-19 pandemic, intelligence agencies from various countries reported that disinformation campaigns were being orchestrated by foreign powers. Their intent? To destabilize the West and undermine trust in its institutions. These campaigns spread unfounded theories like the virus being a bioweapon or linking it to 5G technology. Now, onto the second origin, fear and uncertainty. It's human nature to seek explanations in times of crisis. We crave understanding. It gives us a sense of control. When a pandemic like COVID-19 hits, it's a perfect storm of fear, uncertainty, and a thirst for answers. This creates fertile ground for conspiracy theories to take root and spread. People start to connect dots that don't exist, fueling baseless theories like the virus being intentionally created or vaccines containing tracking microchips. It's important to remember that these conspiracy theories aren't harmless speculation. They have real-world consequences, undermining trust in public health measures and hampering global vaccination efforts. From promoting dangerous unproven treatments to causing vaccine hesitancy, they pose a significant threat to our collective well-being. Understanding where these theories come from is one thing, but what impact do they have on public health? Stay tuned as we delve into the repercussions of these conspiracy theories in the next scene. What happens when misinformation overshadows facts? Imagine a world where the lines between reality and fiction are blurred, where half-truths and unfounded theories are treated as undeniable facts. This is the world we live in when conspiracy theories about public health issues like COVID-19 are allowed to proliferate unchecked. These theories have a profound impact on public health. They undermine the hard work of healthcare professionals, scientists, and policymakers who are striving to keep us safe. They foster skepticism and distrust in authorities, institutions, and even in the very science that's meant to protect us. One of the most visible effects of this is vaccine hesitancy. Despite the clear scientific consensus on the safety and efficacy of COVID-19 vaccines, conspiracy theories have convinced many to reject these life-saving shots. They've been misled by claims that vaccines contain microchips for tracking or that they alter human DNA. This misinformation has led to a significant challenge in global vaccination efforts, which are crucial to ending this pandemic. Then there's the non-compliance with public health measures. Conspiracy theories have led some to believe that mask mandates are a form of control or that social distancing is unnecessary. This non-adherence to preventive measures not only puts the non-compliant individuals at risk, but also endangers those around them. Moreover, these theories promote unproven and even dangerous treatments for COVID-19. From ingesting disinfectants to using unapproved medications, these alternative treatments can have serious and sometimes fatal health consequences. Conspiracy theories have also been blamed for the spread of the virus to regions without 5G infrastructure. This unfounded theory has caused a lot of unnecessary fear and panic, ignoring the fact that the virus is spread through human contact and not radio waves. Now, more than ever, it's crucial that we prioritize facts over fear, science over speculation. We must challenge these conspiracy theories and the damage they cause to public health. Now let's debunk these theories using scientific evidence. Ready to separate fact from fiction? Let's dive into the murky waters of conspiracy theories armed with the flashlight of science. First on the list, the claim that COVID-19 was intentionally created in a laboratory as a bioweapon. This theory is as dramatic as it is baseless. The scientific consensus strongly supports the zoonotic origin of the virus, which means it likely jumped from animals to humans. This isn't unique to COVID-19. Many viruses such as SARS and MERS have similar origins. Next up, we have the theory linking the rollout of 5G technology to the spread of the virus. This theory ignores a glaring fact: the virus has spread to regions without 5G infrastructure. Moreover, viruses are biological entities that cannot be transmitted through radio waves. This theory has been widely debunked by experts from various fields. Now let's talk about vaccine misinformation. Some theories suggest COVID-19 vaccines contain microchips for tracking or are capable of altering human DNA. These are serious allegations with no scientific backing. Vaccines are developed through rigorous testing and are aimed at saving lives, not tracking them. As for altering DNA, vaccines work by teaching our bodies how to fight the virus, not by changing our genetic makeup. Lastly, we have conspiracy theories promoting unproven or dangerous treatments for COVID-19. Ingesting disinfectants or unapproved medications can lead to severe health consequences. It's critical to follow advice from reputable health organizations and medical professionals when it comes to treatment. As we've seen, these conspiracy theories lack scientific support, but why do they persist? Opening. Why do these conspiracy theories continue to thrive despite being debunked? Now let's delve into the reasons behind the persistent nature of such theories. It's quite an intriguing aspect of human psychology. In times of crisis, like the ongoing pandemic, our brains crave control and certainty. When the world around us seems unpredictable and frightening, conspiracy theories can falsely provide a sense of understanding and order. These theories offer simplified explanations for complex issues, making them alluring to some. They present a world where everything happens for a reason, where there are no accidents or coincidences, but life, as we know, is rarely that straightforward. Additionally, these theories often foster a sense of belonging. They create communities of believers united by a shared understanding of what they perceive to be the real truth. It's human nature to seek connection, and theories can offer that, albeit in a misguided manner. Now, let's shift our focus to the role of social media. In the digital age, conspiracy theories can spread like wildfire. Algorithms often promote content that generates strong emotional responses, and conspiracy theories fit the bill perfectly. They can incite fear, anger, and disbelief, leading to increased shares, likes, and comments. This, in turn, prompts the algorithms to show the content to more users, creating a vicious cycle of misinformation. Furthermore, the echo chamber effect of social media platforms can reinforce these beliefs. Users are often shown content that aligns with their existing views, which can strengthen their belief in these theories and isolate them from differing perspectives. So, as we navigate these uncertain times, it's crucial to recognize these psychological and technological factors that contribute to the persistence of conspiracy theories. Understanding why these theories thrive can help us combat them effectively.
the pandemic is a hoax, or that 5G networks are spreading the virus. These theories are not just fascinating tales to ponder over a cup of tea. They can, and unfortunately do, have serious implications on public health initiatives. COVID-19 conspiracy theories are more than idle gossip. They're prevalent, pervasive, and persuasive. They thrive in an environment of fear and uncertainty, and the pandemic has provided an ample breeding ground. As the virus spread across the globe, so did these theories, finding fertile ground in social media and drawing in millions of believers. But why are we so concerned about them? Here's the crux of the matter. These conspiracy theories can cause tangible harm. They can undermine public trust in health authorities, sow doubt about effective treatments, and discourage preventive measures like mask wearing and social distancing. They can create divisions in society, stigmatize certain groups, and even incite violence. Worse still, they can divert valuable resources. Time, energy, and funds that could be used to fight the pandemic are instead spent on debunking these theories and repairing the damage they cause. This is not just about misinformation. It's about the potential for significant harm to public health. More insidiously, these theories can have a profound impact on mental health. In a time when people are already under immense stress, the fear and anxiety stoked by conspiracy theories can exacerbate feelings of helplessness and despair. This can lead to a vicious cycle where fear fuels the spread of conspiracy theories, which in turn fuels more fear. Let's delve into some of the ways these conspiracy theories can harm public health. As we navigate this complex issue, we'll explore the impact of stigmatization, the undermining of vaccination efforts, the diversion of resources, and the toll on mental health. We'll also discuss potential strategies for countering these theories and promoting accurate, reliable information. After all, in a pandemic, the truth is not just a matter of curiosity. It can be a matter of life and death. Firstly, conspiracy theories can disrupt public health measures. These theories, often born from fear and uncertainty, can undermine the public's trust in health measures. Trust is the bedrock of any public health initiative, and when it's eroded, it paves the way for non-compliance with guidelines. Imagine a society where masks are ridiculed, where social distancing is viewed as an infringement of personal freedoms, and where hand sanitizers are seen as a ploy for corporations to make money. This is the reality in places where conspiracy theories have taken root. The increased transmission rates in these areas are not mere coincidence. They are a direct result of this mistrust. Moreover, these theories don't just affect individual behaviors. They influence community attitudes and societal norms. A society skeptical of science and health measures is a breeding ground for disease transmission. This mistrust can make controlling the pandemic much more challenging. Secondly, conspiracy theories can lead to stigmatization. As we delve deeper, we discover that certain conspiracy theories, unfortunately, point fingers at specific groups or nations, blaming them for the origin of the pandemic. This blame game, fueled by misinformation and unfounded rumors, paves the way for stigmatization and discrimination. It's a distressing reality that people from these unfairly targeted groups may experience social ostracism, prejudice, and even physical harm. This discrimination doesn't just stop there. It seeps into various facets of life, including workplaces, schools, and public spaces, creating an environment of fear and hostility. The ripple effect of this stigmatization can be enormous, leading to negative social consequences. More than just a societal issue, it's a human issue that can have serious psychological impacts on the victims. It can exacerbate feelings of isolation, anxiety, and depression, deepening the emotional wounds of an already traumatic pandemic. This stigmatization can have serious psychological impacts and further divide communities. Thirdly, conspiracy theories can undermine vaccination efforts. The crux of the matter is that these unfounded theories, spreading like wildfire, can discourage people from getting vaccinated. They can create a climate of fear and skepticism around vaccines that are, in fact, our best defense against the pandemic. These theories often exploit uncertainties and fears. For example, they might claim that vaccines alter DNA or implant tracking devices. Despite being completely unfounded, such claims can be persuasive and create widespread vaccine hesitancy. This can be a significant obstruction in our global efforts to control the pandemic. Vaccination is the key to achieving herd immunity, which is when a large portion of a community becomes immune to a disease, making the spread of this disease from person to person unlikely. Without widespread vaccination, achieving herd immunity becomes much more difficult. Thus, it's crucial that we debunk these conspiracy theories and promote accurate, evidence-based information about vaccinations. Fourthly, conspiracy theories can divert critical resources. Picture this: a healthcare system, already stretched thin, now also has to grapple with a surge of misinformation. Every moment spent debunking unfounded claims is a moment taken away from life-saving efforts. This is not just a drain on time, it's a drain on financial resources too. Money that could be spent on vaccines, treatments, or public health education is instead used to counteract conspiracy theories. The impact is not just immediate, but also long-term. The more resources we divert today, the less we'll have tomorrow for other vital public health initiatives. This could mean fewer vaccinations, fewer health screenings, fewer preventative measures. And it's not just healthcare professionals who bear this burden. Government bodies, research institutions, and media outlets also expend valuable resources to combat these misleading narratives. This can result in less effective responses to public health crises. So the cost of misinformation? It's higher than you might think. Lastly, conspiracy theories can impact mental health. The constant barrage of misinformation and unproven narratives about COVID-19 can weigh heavily on our minds, fostering an environment of fear, uncertainty, and stress. Picture this: being relentlessly exposed to unsettling theories that challenge the validity of trusted health authorities and the science behind the pandemic. This can trigger anxiety, as it creates a sense of insecurity and unpredictability about the world around us. The fear of the unknown can be overwhelming, and when coupled with the social isolation imposed by the pandemic, it can exacerbate feelings of loneliness and despair. Moreover, the constant stress and anxiety can lead to more severe mental health issues like depression and post-traumatic stress disorder. The mental health consequences of these theories can be widespread and long-lasting, underscoring the urgent need to address and debunk these harmful narratives. Now that we understand the impact of these theories, how can we counter them? Tackling COVID-19 conspiracy theories is not a simple task, but there are strategies that can be effective in this battle. One of the key elements is to promote media literacy. By enhancing critical thinking skills, we can encourage individuals to discern reliable information from misleading content. It's about fostering an environment where people question the sources of information they encounter and seek out diverse viewpoints to form a balanced understanding. Transparent communication is another crucial strategy. Public health authorities must address concerns and questions with clear, evidence-based information. In a world where misinformation can spread like wildfire, it's essential to provide people with accurate, understandable, and timely information about the virus and the measures being taken to combat it. Debunking efforts by fact-checking organizations and researchers also play a pivotal role. By actively debunking conspiracy theories and providing accurate information, they can help to dismantle the web of misinformation. They act as a bulwark against the tide of conspiracy theories, providing the public with the tools to separate fact from fiction. Another core strategy is engaging with communities directly. Building trust within communities through local leaders and healthcare professionals can help counter misinformation. Trust is the bedrock of any successful public health initiative. When people trust the information they receive, they are more likely to adhere to public health guidelines, get vaccinated, and take precautions that protect not only themselves but also their communities. It's a collective effort. Each one of us has a role to play in countering these conspiracy theories. By sharpening our media literacy skills, promoting transparent communication, supporting debunking efforts, and engaging with our communities, we can help to stem the tide of misinformation. By implementing these strategies, we can counter misinformation and promote accurate information during public health crises. In conclusion, COVID-19 conspiracy theories have had a significant impact on public health. They've disrupted measures, stigmatized groups, undermined vaccination efforts, and diverted resources. They've also taken a toll on our collective mental health, sowing seeds of anxiety, fear, and stress. It's evident that these theories are not just harmless chatter, they are a significant roadblock in our path to recovery from this global health crisis. But there's a silver lining. We have the means to counter them. Through media literacy, we can foster critical thinking skills that separate fact from fiction. Transparent communication from public health authorities can dispel doubts and provide clarity. Fact-checking organizations and researchers tirelessly debunk myths, arming us with truth. And engaging with communities helps build trust, a cornerstone in combating misinformation. By promoting accurate information and debunking misinformation, we can support effective public health responses to crises like the COVID-19 pandemic. Thank you for watching. This is The Truth Chronicles, where we debunk myths and spread the truth. We appreciate your time and your desire to understand the truth behind the many conspiracy theories circulating around COVID-19. We hope this video has been informative and helped clarify some of the misconceptions. Remember, it's essential to rely on verified sources for your information. Stay curious, stay vigilant, and stay informed. Join us next time as we continue to explore and debunk the myths that cloud our understanding of the world around us. Until then, stay safe and take care of each other. Remember, we are all in this together. Stay tuned for more enlightening videos.